And we are back on the Wake Up Call. Good morning. It is good to be back. I'm Brian Perry, and I'm here with a very special guest, Mr. R.M. Fleming, and we are very, very excited to be back on the Wake Up Call. It's been a while since myself and my wife Tracy have been here. She's actually out on location right now, so she will be back here next Wednesday at about 9:20 to help me with future fitness segments. But before we get going and we get into the subject, I want to make sure that you guys know that you can contact us by going to email brian@loadedtv.com, or you can Twitter us at Brian and Tracy to ask any questions about this segment or any future segments that we may have. One of the things that we want to accomplish when we do our fitness segments is to help people, regular people, figure out how to live a healthy lifestyle through nutrition, training, fitness. But we also want to have some fun with it and interview different people, experts in their field, athletes, whether they be amateurs and or professionals, things like that. So today is no different. Today we have a very, very special guest today. It's our guest today is Dr. R.M. Fleming. He is a published author and a renowned cardiologist, and we welcome him to the show today. So thank you for being here today.
Brian, thank you for inviting me, and hopefully we can do some things during this segment that will help shed some light on things that people can do to improve their heart health. Absolutely.
So one of the things that we need to remember is that the heart is a muscle, and the heart is probably the most important organ that we have, is the most important organ that we have in our body. But a lot of times people don't really think about the damage that they're doing by a poor nutrition or lack of training and things like that. And so one of the things we want to talk about, after you kind of give us an overview, because you've done a lot of different things. You've been published. We got a couple of books up here. One is Stop the Inflammation Now. The other one right there is
How to Bypass Your Bypass. And want to give a shout out to all my friends in England and to the Queen, who received a copy of this many years ago.
Okay. But you've been on 2020. You've done a lot of different things. So maybe you can kind of give us a quick overview of your training, and then we'll get right into the meat of talking about heart health.
Right. Well, I'm a research scientist, originally trained in the 1960s with funding from the Kennedy administration. And I ended up going to the University of Northern Iowa, received several degrees in physics and biology, chemistry, and psychology, then went to the University of Iowa, where I trained also as a research scientist and worked with high blood pressure and heart disease. And from there I went to Creighton University for my residency and the University of Texas Health Science Center in Houston as a cardiology fellow, and have been doing research in the area of heart disease and diet and nutrition for a couple decades anyway.
So what that's telling you is that this guy knows what he's talking about. So when we bring him on today, that's the whole point, is to bring you guys some quality individuals who understand the value of what we're talking about when it comes to fitness. And so one of the things that I wanted to ask you is, and for everybody else out there, is can you name like maybe two or three different diseases that are a direct correlation to our poor nutrition or our lack of exercise or other things?
Right. Well, there's many diseases that are related to diet and poor nutrition and smoking and those types of problems that people are dealing with across the country and across the world. Heart disease, diabetes, obesity, high blood pressure, certain types of cancers. The list goes on and on. All of it's related to an inflammatory process that the body's dealing with. All of it's related to dietary and lifestyle practices that people have. These diseases didn't exist 50 to 100 years ago.
Right.
There are lifestyle changes that are part of what we do.
Right. And so some of the symptoms for let's say clogged arteries. I'm going to try to keep it in layman's terms here. Clogged arteries. So give us some symptoms, some signs and symptoms that we may want to look out for as we start our training programs or as we try to adjust our diet.
Right. Well, the classic one is chest pain, a squeezing sensation, and radiating down the left arm. I think most people are aware of that. Shortness of breath, particularly when you're trying to do something. That's classic. Something that people don't tend to key in on but is very common is nausea. And in fact, that's more common in women, not because just simply because it's nausea, but it relates to the artery, the right coronary artery, that tends to be more of a problem in women. So those are very common issues. Sweating, discomfort in the chest, and that nausea, and shortness of breath, those are really the key symptoms. And if you're having that, those are the types of things to get in to see your doctor about sooner than later.
Okay, and that's good advice. In fact, we encourage anybody before you start any kind of exercise program or you try to modify some of the things that you're doing, if you're having any of those symptoms at all, definitely go consult with your doctor before you start any of these things, and that'll work out for you better, hopefully. And so these books, Stop Inflammation Now. Okay, so what if somebody went to Amazon and found this book? What are they going to find in here?
Well, that was actually the result of a number of years' worth of work. We were looking at diet and lifestyle and how it played a role in heart disease. Many people are aware that cholesterol plays a role in heart disease, but it dawned on me back in about 1995 that was not accounting for all the problems. In fact, half the people who had heart attacks had totally normal cholesterol levels. Okay. So it was clear that something else was going on. So through a lot of work, ours, other people we knew, other people in other countries, physicians, non-physicians, we discovered that there were at least 12 things that were risk factors that you could measure for heart disease. Cholesterol being one of those, fats and triglycerides being one, homocysteine, C-reactive protein, all of the types of things that you can get blood tests for that will give you an idea. But also in this book we tell you how you can change your diet, change your lifestyle to make the steps that you need to, because I realize that most people are not going to go out and start a marathon training, and I wouldn't advise people do. By the way, I've already done my workout this morning.
Oh, here we go.
You know,
here we go.
I know you haven't done yours yet, but you're going to do it.
I'm going to go right after this. Look at him.
So I did my 4.5 miles this morning, my 30 minutes of weights, but you don't want to start with that. You can start with very, very simple things. Get out and walk, go bowling, play baseball, do tennis, things that you enjoy doing. Make minor changes in your diet. Don't eat later in the day. Cut back on some of the portions. Diet seems to be something that people feel very strongly about, but the two things that you have to remember about diet and nothing else, total calories and total saturated fat. Too many calories, you're going to make fat. Saturated fat doesn't do much for you. Other than that, I really don't care how you get the calories. There are healthier ways than others, but if you can control the calories and control the saturated fat, you will go a long way to making progress for weight, diabetes, heart disease, certain types of cancers, prostate cancer, breast cancer, you name it.
And when we're talking about a healthy lifestyle, it doesn't mean that you're going to get up and go and compete. It's about longevity. It's about extending your life. It's about enjoying the life that you have without the burdens of being overweight or having those other things, that the shortness of breath, the things that will slow you down so that you can't enjoy being with your children or being out with your family, or there's a number of things. Having a good night's sleep and things like that. So I got a question though. When we're talking about the different countries and when you're doing this research, is there one country that it had less of these issues than other countries?
Well, there are several countries that have had less, and China is a very good example, and Japan are good examples. But the reason why China is a good example is that if you look at the children right now, and if you look at American children from kindergarten to 12th grade, a quarter to a third of them have either high blood pressure, diabetes, high cholesterol, problems that related to these health-related issues. But if you look at the children in China, their diets have changed the most drastic, China and Spain. And the children in those countries, their rate of heart disease are exceeding our children right now.
Wow.
Just simply because of the dramatic change in the diet and lifestyle that these countries are going through. And so it's very clear this is not a genetic problem. The genes haven't changed in the last 50 to 100 years. We're all somewhat predispositioned. We're the survivors, so our bodies are designed to survive. Now the question is whether we're going to kill ourselves off, in the diets and lifestyle we have. So the kids in China, people in Japan, and you see the children in Spain, they too are noticing these escalations in their heart disease. Too much food, the portion sizes are getting bigger.
And that's one of the things that I wanted to talk about was our portion sizes. I mean, the obesity rate in kids in the U.S. is moving up, it seems like, all the time. And that's one of the things that, for Tracy and I, is one of those things that we really want to help parents understand and be able to address as well. So it's portion sizes, it's that fast food mentality, things like that. And so whether you're in the U.S., whether you're in China, Japan, Spain, we got to take care of our kids, we got to take care of ourselves, and that's the whole point of us doing these fitness segments, is to try to show you ways, not only through scientific research, but also through some of our segments which will show you how to actually exercise and train properly and get involved in other types of sports and athletics. So it's a good thing, and today has been one of those days where we really appreciate having somebody at your level being able to sit in here at the Wake Up Call.
Brian, I have a question. Can the doctor do you recommend any herbs or vitamins for,
Natalie's asking about herbs and vitamins as far as controlling high blood pressure.
There's some soft data
Okay.
on different types of natural compounds. You know, one of the things I think that there's an issue is that a lot of people think that physicians are anti-natural or anti-food. And I always explain to people that the foundation of medicine started from what we knew about diet and nutrition, and if somebody's forgotten that, then they've forgotten it. The best studies I'm familiar with are that actually celery and foods like that have chemicals in them that seem to relax the blood vessels and may lower high blood pressure. As a medical student at Iowa, we did sodium and high blood pressure research with people by giving them very high salt milkshakes and then very low salt milkshakes and seeing what happened to them. Some of that is hereditary, but as far as a food that probably helps more than anything else, celery is probably one of the ones. Yeah.
There you go.
And then maybe onions, are those good? And like garlic and stuff, right, for blood?
Onions and garlic is the other
yes,
question.
in fact, I think actually the studies show that if you had 9 or 10 cloves of garlic in a day, you could actually drop your cholesterol significantly.
And your spouse, if you breathe on her. So,
or you can both have the garlic, and then it doesn't matter. There you go. Right.
All right, thank you.
So there's a couple of questions up here that are asking. One of them is from Tivo. It says, I'm 6'3", 303. Is there really such thing as an ideal weight? You know, and I'll just give you my opinion on that. If you're 6'3", 303, it's going to depend on a couple of things. How you feel, how you look in the mirror, and how you feel about yourself internally. But more importantly, if you feel like you're overweight and you want to adjust that, let's look at your diet. What kind of foods are you eating? What kind of exercise are you doing? And if you're very active and very fit and you're eating healthy, then maybe 303 isn't a bad weight for you. I'm not sure that there is an ideal weight. It's what's ever going to make you feel comfortable in your own skin. And as far as my opinion, that might be something different from the doctor's perspective, though.
Well, I think my comment on that would be body mass index is something that's a challenge. It's an effort to try to rein in all the people that are worried about their weight compared to their height. But I think it's really a matter of what that weight is due to. If that weight is due to fat, you have a problem. If that weight is due to lean body muscle, that's a different issue. I mean, muscle is not going to produce health problems for you, but the fat, particularly the fat around the belly, produces a lot of this inflammation that causes a lot of these diseases. So depending upon what your weight's due to, muscle or fat, that's the key.
All right. Well, we really appreciate the doctor being here. His books, we can find these on Amazon, correct?
You can find
we
those
can get these
on
books on Amazon, so that's where you need to go. If you have any other questions, Brian@loadedtv.com, or you can on Twitter @Brian and Tracy. Any questions, we'd be glad to answer those. So thank you guys very much, and we'll be right back with the wake-up call.
Thank you. And I noticed they rushed off the dessert before we get
We're going to
out
get
here.
some right now.